Hello, this is Dr. Kundlas, and today we will be talking about winter illness. Winter is for seniors not only physically challenging, physiologically also very challenging because it brings unique challenges for our seniors because of their physical increased demands and also physiologically because as we live we accumulate a lot of disease and disability over the period of time. Let's start why it is important for all of us to discuss this thing and why we worry very seriously about the senior in winters. Age weakens our immune system, which makes us at higher risk to develop very common preventable diseases. So these common illnesses which are 100% preventable and nobody should die of these problems. Further, they have a lot of skin changes, reflux problem, and decreased muscle mass. The condition of decreased muscle mass as we are aging is called sarcopenia. Before I go over all the individual diseases, I want to highlight certain things which is the core message which I want to convey during this video. Number one is the vaccines. I truly believe the vaccine rate is very poor. If vaccines are taken by all seniors, we will not have so many deaths. Number two, nutritional status. We must eat good all the time, but we must eat really good during winters. Number three, exercise. I understand few of us will not be able to go outside and do this one is, but we must move in the house. Number four, we must have a very strong relationship with our primary care physicians. Also, make sure you call your primary care office and find out that they have telehealth services so they could see you if you can make it to their offices. Also, ask them whether they have walk-in slots because if you develop some kind of a problem, you must have access to the care. Let's discuss infectious medical conditions which are common during winter seasons. We'll start with the simple stuff. The most common thing is common cold. Common colds is a rhinovirus infection and they only involve the upper respiratory tract. Then some bacterial infections like streptococcus, strep throat is very common. And these bugs, once they go into lower tract, bronchitis is very common. But diseases which kill senior, number one, flu. Influenza affects about 10 to 12% of all the seniors per year. And it is number one cause of a reason of death, 65 and above. The flu vaccine should be given to you once a year, and best time is take it early in the winter. If your immune system is compromised, you may not mount enough immune system or the protection against to help you. So that's why in the senior flu shot, the content of this antigen, which we call it attenuated virus particles, the concentration is high so that we give higher concentration your body can mount and you could improve your health and you have a good robust protection. Second disease is RSV. RSV starts exactly like a common cold, but this is a little bit more dangerous. We get on an average for almost 200,000 hospitalizations annually due to RSV. And it is estimated that we lose about 14,000 seniors to RSV. COVID-19 is a very unique virus because it is mutating at a faster than other viruses which we talked about like norovirus, RSV, flu. This virus is changing or mutating at a fast. Scientists are following it very closely. COVID shot is going to be a ongoing vaccination and we should put it into our schedule. Next infectious disease in winter is very common is pneumonias. Because we are in a closed environment, we are in a close contact, the bugs Streptococcus pneumoniae are very common in winter, especially in seniors above the age of 65. This pneumonia shot protects you about up to 90%. This is the best time to be a senior because we have highly effective vaccines to prevent all of them. Now let's shift gears and check about non-infectious diseases. In winter, incidence and prevalence of anxiety and depression is very common because we don't have a problem in Florida, but rest of the United States does not get enough sun. And once we don't have enough daylight, the chemical chemistry in your brain changes, all the circadian rhythm changes, and you are at very high risk for anxiety and depression. It goes by the name SAD, seasonal affective disorders. If we eat properly, exercise, and maintain our muscle mass, all of the non-infectious pathologies will not happen. The evidence lies that you must protect yourself with your vaccine, you must eat properly, and if you do all these measures, you will have smooth sailing. I hope I have made enough case that you must take flu shot, pneumonia shot, RSV shot, shingle shot, and anything which you need to keep you safe. Improve your nutrition, eat properly. I would appreciate if you could like, share, and subscribe to our channel. Thank you very much.